afternoon, everyone. Thank you for being here. This is our January 22nd, 2025 Board of County Commissioners business meeting or work session, sorry. In our work sessions, we don't take public comment during this time. This is just a time for us to ask questions and get answers on a particular topic. And also, we don't take any votes or make decisions during this time, but we will, of course, take public comment during our 5:30 business meeting following this. We are here to hear from the leadership of Lawrence Douglas County Fire Medical. And Sarah, if you have any words, otherwise I'll pitch it to Chief.
Well, I think Mackenzie wanted me to say a few things. And so Mackenzie, if I forget something, let me know. But we currently have a 3-year agreement with the city of Lawrence for the joint governance of Lawrence Douglas County Fire Medical. The commissioners approved a year extension last year in 2024. So we're actually working on year 4 of that agreement. And there's a team, and you see reference to that in maybe part of the presentation. Like the governance committee is myself, Mackenzie, the chief, and Casey Toomey from the city of Lawrence. And we have some budget representation from the city of Lawrence and my team as well. So Allie Porter and
Rochelle.
Yeah. And Rochelle's last name, anyway, from the finance department for the city of Lawrence. And we've been meeting every other month for about the last 6 months to talk about how we update the governance agreement. And Chief Coffey, former Chief Coffey, and myself were a part of the big rewrite of this agreement 4 years ago. And that process took us 3 years to write a 3-year agreement. And we did a complete rewrite of that agreement 3 years ago. So 3 years has gone really fast to bring us back here to think about governance again. And as that committee started working on it, we realized I think we just need some direction from the governing bodies about how much do you want us to rewrite? What do you want us to look at? It feels very quick. I mean, I feel like we just did this, but 3 years has gone by. So, and because of our joint governance arrangement, we thought it was important to check in with both governing bodies and try to get some feedback, because ultimately you will be brought these agreements for approval. So we want to make sure we really have the right parameters. I think after this, a logical next step is to create a project charter. And, for this project and how we will continue to work together. I'd like to bring that back to both bodies and make sure you're okay with that charter, because ultimately this comes to the commissioners for approval. So some of these questions may seem kind of straightforward or basic, but we want to make sure we're doing what both governing bodies want us to do. And knowing that, until everything's finalized, each governing body has the sort of right to sort of change their mind. Is that kind of what we were hoping to get, Mackenzie? Great. Okay, so now I'm going to share my slide. I'm going to share Mackenzie's slides and turn it over to the LDCFM team to present. And then I will chime in where I think we need to. Here we go. All right.
Good. Thank you. So welcome, or thanks for having us. I am Joe Hardy, the acting fire chief for LDCFM. And so I know that the fire chief's position has been involved with this, although I have not been involved with any of the past experience of any of these the memorandum of understandings or any of this talk. So this is somewhat new to me, but I know the importance of it and really gathering what you as a commission would like to see, but also we would talk to the city of Lawrence yesterday and kind of getting guidance from them and what they're looking at. And so, it's not like we're starting from scratch, because we've got a lot of stuff that we've got some good stuff here. But I'm going to talk a little bit about a history of kind of where we came from, kind of where we're going to go to. So the next slide.
Kenzie always makes these really dense PowerPoint slides, and they take forever for me to advance. So
you are welcome.
Yeah, you're welcome. It should be going. I don't know why it's not.
Well, when the slide comes up, just a little bit, just a little history. So in 1996, the idea of merging two departments came up. And so you see the Lawrence Fire Department was led by Fire Chief Jim McSwain, and Douglas County Ambulance Service was led by Director Chief Ted McFarland. And so the merger happened in 1997, and that was when it all started together. That was the first class. I was actually the first class to be involved in that, and so I was the first recruit academy that graduated that we were merged, and so I was pretty proud of that, and I still am proud of that. And so we had a logo change at that time when we merged both companies, and we had the documentations to show what we were looking at. Over the years, you see the time frame. Sarah kind of hit on that, of times when we reevaluated things, and so we went for a time there where we had a long span, and then you spend a lot of time on readdressing some of the issues, and just like anything else, things change, and that's important to gather what we've had and where we want to go. Logo changes. In 2007, we had a logo change that highlighted Lawrence, Douglas County. Lawrence was a little bigger than Douglas County, and we looked at that, and we wanted to make sure that we included both entities equally. And so you see the change that we have with Lawrence, Douglas County Fire Medical on our logo. And so we've changed that over that time, and we're pretty proud of that as well. It's not necessarily like for the bling of it, but it's really for who we really are and who we represent. And so we do city fire, we do county EMS, and so it's the call volume keeps going up and up and up. And so readdressing some of these topics are very important for us because we need to know where we're going to go and how we're going to get there. So that's why this relationship has got to start off with gathering the information from you, just as important gathering from the city. And I feel that we can be that middle entity to help get that to where we all have the same goal of helping people.
All right, so if you saw one of the presentation from last night, we've changed it a little bit, knowing that we have two new commissioners, that this is the first time that we've spoken in front of you and presented our information directly to you. So I wanted to give a very, very high level of LDCFM. If you have questions, obviously we can either get you answers if we have those or have a follow-up as well. So LDCFM, we have 7 stations. We have 5 fire medical stations where we have a fire apparatus and a medic unit in the city of Lawrence in each of those stations. And then we have Station 11 and Station 12 that's out in Baldwin City and Eudora. Those are our medical stations. So we have an ambulance in each of those. LDCFM is an ALS provider, so we provide advanced life support EMS services. There's also basic life support, which you would get from an EMT. We have advanced, so you're getting a paramedic or an advanced EMT at all the calls. So we actually have 87 call natures, so 87 things that we can be dispatched to. We work with the Douglas County Emergency Communication Center. They dispatch call types. We might send an ambulance, we might send a fire truck, we might send both. There could be a culmination of different sets that we send to different call natures based on the severity of the risk that we're dealing with. With that, we have around 160 employees right now. We do have civilian staff, we have sworn staff. I'm civilian, I'm not a firefighter. Chief Darling and Chief Hardy are sworn, so they came up through the ranks, they were firefighters. What else about our department? Hardy, do you have anything else to add just about LDCFM personnel in general? We do have our firefighters can go between the medic units and the fire trucks. So they might be assigned to a medic unit one day, and then the next day they might be on a fire truck. We're getting those resources to every call. So if there's a call that's we call it a high priority EMS call, so like a cardiac arrest, we send a fire truck and a medic unit and a chief officer. They each have their roles when they go on scene. If we switch up the people that are on those units, then they all still know their roles. They're all dually trained. They all have their bunker gear to go into a fire, but they also have all their medical gear. So pretty great staff.
Yeah, and I'd like to add as well, recently we've decided as a department to require all of our new employees to attend paramedic school. And so they have a 3-year time commitment to achieve that goal. And so we started seeing a lot of workload on a small percentage of our people. And we had to do something about that because of the career, if you're going to make a career out of it, you had to help with that. So we decided to send more people to school. And so we've currently got 8 people that are starting paramedic school on Monday, and we've currently got 1. And so we have 9 currently attending paramedic program. And it's been a good thing for our members. I think last week we talked about, doing less with less and trying to look at our workload on our personnel. That was one of the things that Chief Coffey focused in on, trying to look out for our people to make their careers go longer. And so that's been a great asset for us.
I think one of the things that I was struck by, when Lawrence Douglas County Fire Medical merged, at the time it was fire and ambulances. And if you called 911 and you had a medical emergency that did not necessarily require an ambulance, a police officer showed up. They were first responders for medical calls until perhaps an ambulance could get there if needed or additional information was determined. When Lawrence Douglas County Fire Medical was formed, that changed. So that came off the backs of our law enforcement partners and onto the work of Lawrence Douglas County Fire Medical. So the notion of who is a first responder has really changed in the entire time that LDCFM has been together. And, I know it seems strange, but actually a unified fire EMS system is somewhat unusual in Kansas. And we did a lot of research on that 3 years ago. I think there were you guys might know 4 or 5, really, that's it. The rest are fire departments and ambulance providers. Johnson County to our east has city fire departments and fire districts, and a countywide EMS advanced life support transport system. And the county runs it. So the fact that we are unified in this, I firmly believe, is more cost efficient for the taxpayers of Douglas County because we're making decisions based off calls and what makes sense. But if I can pick on my friends to the east, what I would say is they have a lot of fire stations. They co-locate some ambulances, some county ambulances in those, but the city fire department is really thinking about its resources and its needs. And, we also did a little bit of analysis. If you look at the ratio of fire trucks to ambulances over there, there's a lot more fire trucks and a lot less ambulances. Our balance is a little more balanced based off of our call volume. And our call volume is not unique. Our call volume is the same as many places across the state in terms of ratio of fire to EMS. Firefighters have done an excellent job of preventing fires and eliminating fires, and building codes and those types of things mean there are less fires. And as we get older and sicker, there's more medical calls. So it's actually somewhat unusual that we are unified in our governance. And that was a big part of that conversation the last time. Do we want to stay together? Do we want to continue to do it this way? Because there are other ways of doing it. Questions?
Can you talk to me a little bit about the differences, or educate me, because I may not know, the differences between the unincorporated areas and how those areas are serviced, and if the 160 staff that you have, does that also include our volunteer firefighters?
It does not. So
Okay.
that is only staff for Lawrence Douglas County Fire Medical.
Okay, so talk to me about how the
The unincorporated area is covered by 3 fire districts.
Okay.
And I'll talk about,
so is the
well-
plan to then incorporate those districts as well into this countywide
CFD 1 and
plan?
2 and 3. Hold on. Okay, yeah. Okay, all right, sorry. So there's 3 that have their basis inside Douglas County, and there is 1 part of a township that is covered by a fire district out of Osage County. And then Grant Township is covered by Lawrence Douglas County Fire Medical. So let's not talk about Grant Township because they kind of change, everything's different there. But if we talk about CFD 1 and 2 and 3, they provide fire service. CFD 1 also does first response, and Karen, correct me if they also do medical first response.
All 4 also provide first response, medical response, but not paramedics, just a
Right.
emergency medical.
Okay, so everybody's up now because I thought for a while there, Palmyra didn't do EMS.
Unless Baldwin is covering for Palmyra.
Oh, yeah. So
Medical.
Palmyra Township is split between CFD1 for medical and City of Baldwin, right? Yeah.
I think that's right.
Okay. So those are first responders and those are volunteers, both for fire and that first response. CFD1 has 5 permanent full-time staff, 6 now. But it's, the rest is volunteers. And then both the city of Eudora and the city of Baldwin also use volunteers to provide fire service and first response, medical first response. They do not have ambulances. They do not transport.
So we provide fire suppression services for the city of Lawrence and Grant Township through an agreement, and then EMS countywide. EMS call anywhere in the county.
EMS, ALS transport, because
Correct.
EMS is a very broad term if you think about emergency medical services, but they do not, it's, the first response is probably going to be provided by a district or a city.
Yeah,
If that
so
makes sense.
I have a little bit of background working on the training side because I've been helping partners. So we have these county agencies that will typically, because you see where our ambulance stations are located. So if there's a EMS call, let's say west of 59 Highway, often the first responders may be the people who are on scene first. And so these are people who are trained at like an EMR, EMT. We actually do have some AEMTs and paramedics, and we have unified protocols now. So they are allowed to practice at their level of state license or under unified Douglas County protocols. But so those people will show up. Sometimes they come in private vehicles. Sometimes they come in like fire apparatus or some other apparatus operated by that agency. And they will, start the initial process of patient assessment, beginning treatment. And then when the ambulance arrives, they'll do the sort of the handoff and then help us load the patient for transport. So it works pretty seamlessly most of the time. And it's very helpful because having those people deployed throughout the county allows us to get that first set of trained eyes on the patient. That kind of help understand?
It does. And
Yeah.
so moving forward, if there were to be a new 3-year service agreement, that the model that you're talking about would probably continue.
Yes. Yeah, that would be that's one of our questions is, do we want to consider a different model?
Okay.
So that, right now the model is that it's just, ambulance ALS transport that is provided countywide through LDCFM. Each of the fire districts have their own taxing authority and they tax their citizens separately. They do not tax people inside the city of Lawrence. And that's provided by those districts. The counties help support that work through a variety of other mechanisms. I don't want to go down that rabbit hole, but I'd be glad to through what John Darling has talked about, is that all of that works under the chief medical officer, Dr. Cross, and they work under his license for that work.
Thank you.
Doris, do you have a question? Okay, all right. I'll go to the next. Anybody else?
I have just a real quick question, Mackenzie. Well, you mentioned the number of current apparatuses we have between fire trucks, ambulances, et cetera.
Yep. Okay. So
And if it's later in the presentation, but I think you mentioned it before and I just missed it.
no, that's fine. I can do it right now. So each of our stations have frontline apparatus, ones that we staff every single day. Right now, we have 5 fire apparatus in the city of Lawrence at stations 1, 2, 3, 4, and 5. Station 5 also has a ladder truck, which we identify because of its different staffing as more of a toolbox on wheels. So there's been conversations about engine 5 being shut down. At that point, we shift our staffing and that ladder can become a fire suppression unit fully staffed, and it can operate as a fire suppression apparatus. Along with that, we have 5 frontline ambulances in the city of Lawrence, and then we have 1 in Baldwin and 1 in Eudora. So 7 total daily staffing, 7 ambulances, 5 fire trucks, and then a toolbox on wheels, the ladder. If we have extra staffing, we can staff that up. It's kind of difficult to change some of the deployment within dispatch when we change staffing on apparatus. So I did forget to introduce myself. I'm Mackenzie Zell. I'm the interim chief of staff with Lawrence Douglas County Fire Medical. And then we also have John Darling, who's our division chief of EMS. And then acting chief Joe Hardy, who introduced himself earlier. Okay, so very brief, what we protect, you guys know this. We protect all of Douglas County. We just talked about our fire suppression services and then also EMS. We have the property value, just because sometimes that's fun to look at. These numbers are a little bit dated, but $10 billion is a lot. And then land, 475 square miles. So we identify as Douglas County part of that first response agency. So that's a part of the land that we protect as well. And then Sarah, perfect. What we do, so we do 4 primary programs, 4 services. We do EMS, so emergency medical services. We do fire suppression, hazardous materials response, where we have certain levels of certification and technicians that are trained to respond to hazmat calls. And then also tech rescue, technical rescue. Typically, we think of that with like ropes and like boats. So we do have all 4 of these risk classifications in Douglas County that we respond to. And so it makes our conversation about fire or EMS a little bit more tricky, because some fire departments will go to all of these. Some EMS departments will go to a handful of these, not just EMS. So when we talk about data in the future, that's just one thing to keep in mind. Who we are, there's 3 of us up here. We are, like I mentioned, a part of a group of 160-ish. Right now, we're a little below that, but we have some really great people who I think are all happy that we're up here presenting instead of them. So really why we're here to talk about our EMS agreement and the direction that you all would like to go with it. And that includes one of, or some of the components that are in a document, our community risk assessment standards of cover. This document basically says, what is your risk in that 475 square mile area? And what are the resources that you have to be prepared to combat that risk, to mitigate that risk? So basically, through the agreement, we'll be looking at certain parts of the community risk assessment standards of cover and identify what service levels are adequate for the community, and then also what direction we want going forward, which will tie into our strategic plan.
Go ahead.
We do have a few maps up here. So you'll see the green maps quite a bit whenever I'm here, probably. These are our response times. And so we have benchmarks, which are targets for the time response that we have for different segments of our response time. So there's alarm handling time, which is solely in dispatch. There's turnout time from when dispatch says, LDCFM, you've got a call to go to. We get ready, we get on the truck, then it starts our travel time. In full, those 3 components make up total response time. On the green map, this shows our travel time aspect. This is one of the things that by different metrics we can control, whether that's additional resources placed strategically throughout the community, more of those. Also, we've done things like with our intersection, like when a truck is coming up to an intersection, opening up that intersection for us to go through. There's different things that you can do. Also, like community risk reduction efforts that can impact this. So right now we have a 4-minute travel time benchmark for the city of Lawrence or urban areas. So this includes Baldwin and Eudora. And then for the county, we look at a 10-minute drive time in some aspects and 8 minutes in others, just to see the different comparisons. So later on this year, we're definitely going to be talking about service levels and benchmarks and looking at those target response times and how our performance compares to those.
Kenzie, this is sure, Kelly. Is there any way, you talked a little bit about how the first response happens out in the unincorporated area. Is there any way to incorporate that information into the response time, or is that not possible?
It's possible to a degree. It will be more possible, in my opinion, next year when we have a new federal data system for the fire service. So right now we have a data system where we all do our reports, send them to the state, and it's very siloed, and then they send it to the federal side. This new system that's being implemented in 2026 will actually combine all of the data, use census data, use all these different data layers so that we and you all can make policy decisions. We can inform you of the data in a more streamlined manner that's consistent throughout whatever jurisdiction, and you can see locally what the performance looks like and what the response looks like regionally, and then also if you want at like the federal level.
That sounds exciting.
But right now it is very difficult because it's all siloed.
Okay.
Can I say, I think Chief Baxter, who was formerly with CFD1, was working on collecting that on a first on scene data set. And I don't know what happened with that now that he's not with that department, but it'd be worth seeing what we can track down, what he was able to pull together, because I think some of that information is out there for a couple of years worth.
Yeah, and I do believe that, so we are taking notes during this meeting so that we can follow up with you guys on this stuff. Part of the issue with data collection and data comparison is just the ability, like the workload to do so. So that is one thing that the system basically gives every department an analyst in the computer for free. And so that'll be a lot easier. And yeah, we're really looking forward to it. But we will follow up with Chief Talkington and see if we can get some of that data. Mathis, thank you. Goodness gracious.
From a compliance perspective, does LDCFM have any standards that you must adhere to for benchmarks for the 4-minute city travel benchmark and or the 8 to 10 county benchmark? And if so, are you meeting those?
Okay, so we are accredited. Our accreditation process, if you're familiar with other accreditation processes, is very different. So the accreditation process that we go through basically says take a good look at who you are as a department, be able to write to that, to speak to that 251 performance indicators that we look at response time as part of that, and then look at our benchmarks, identify the gap if there is one, and then create a plan for moving forward. And then that information gets verified and validated through a third party. With our benchmarks and how they are set, these are a goal that is set by the authority having jurisdiction, you all in the city of Lawrence. So that's one of the conversations that we'll be presenting. It came up in our last accreditation report as a recommendation to look at those. We look at them at the 90th percentile. So a lot of agencies, not fire agencies, look at things in like an average. We do the 90th percentile, and that's industry standard. And then keep that consistent throughout all the presentations, and all the data is the same. So we will be looking at that. We are not meeting those goals. We have a few areas we look at when I mentioned like the alarm handling, the turnout time, and the travel time. We do look at each of those segments, and we look at rural and urban because they have different benchmarks, and look at that comparison, and then look at the aggregate of that data as well. We are working on our annual compliance report that we have to do every single year right now, where we look at that data and then we highlight those times that we are meeting our goals. So you guys will all be receiving that here in the next like month and a half or so, and we can have more conversations on it.
Okay, because at this time you don't necessarily know why you're not meeting those goals, or you'll know fully in that report.
We'll know what call types, we'll know how we're responding with the resources that we have. And then that can help us look into more specific things. Is it a problem because we have a lot of calls that our units are busy, that we're taking forever to get places? Is it because of our locations? That's when you dig into really like the root cause.
Okay, or a need for more personnel, or a need for more funding.
Yep.
Need for more firehouses.
Yes.
Yeah, more trucks.
Mhm.
Okay, thank you.
Gene Dorsey here. I had a question about the total incident count. Do you have a breakdown between fires and ambulance?
We do.
Is it mostly ambulance?
Do you want to take a percent guess?
80?
So last time I checked, it was 70%, right around 70%. We fluctuate a little bit. Earlier, I mentioned the 4 different service programs that we have with hazmat, tech rescue, fire, and EMS. The difficult part about the calls that we respond to are some of the calls might be both a technical rescue and a fire call, or both an EMS call and a fire call. And so trying to identify in our current data system what is what, it basically dials down to that report writer saying, well, was it more of a car accident, or was it more of a fire because the car caught fire? Or was it an EMS because the driver had a cardiac arrest? So EMS, tech rescue, and fire, what do I pick? You're going to pick one. We're going to report on one. With a new data system that's coming in 2026, they will be able to say it was a fire, an EMS, and a tech rescue call all in one incident. We'll be able to come to you to say, hey, in this call, we used these resources. And then that also helps with either justification or evaluation of the resources and the funding for certain or for specific service programs. So right now it's 70%. Next year, we'll have a little bit of a different conversation with how we identify certain things and classify things.
I wanted to just, I think standards of cover is a kind of strange term that didn't make a lot of sense to me when I first got doing this work. And so if I can explain it, and Mackenzie will correct me if I'm wrong, it basically means how many staff are on working at any one given time. So there's 2 in an ambulance, there may be 4 in a fire truck. So we're counting the staff. So even though the number of apparatus is about, 5 and 5, it's really, there are 2 people in an ambulance and there's 4 in a fire truck. Did I get it right?
For our minimum
Ish.
staffing, yes.
Yes.
For our standards of cover, so just like if we adjust our staffing, we're going to adjust how many units go to each call. When for 87 call natures, we go through each of those and say, what's the risk? What resources do we need? How do we mitigate this risk? If it calls for 16 people and we're able to get that by sending X amount of fire trucks and X amount of medic units, we change up staffing, that number becomes a different as far as apparatus that we're sending because we've identified to mitigate that risk properly, we need X amount of people. That's something that we talk about a lot and kind of like the science behind fire and EMS response, actually any response. But yeah, the standards of cover also is very similar to a lot of like the emergency management documents that you'll see, where it's what risk is in our community, whether that has to do with like the people or the property or the geography, the demographics, anything and everything.
And that's where the 4 minutes and the 10 minutes come from. Those are all based off of, risk reduction. If you can get to a heart attack within 10 minutes, you can save lives.
But the 4 minutes and the 10 minutes are theoretical. This is theoretically the drive time. It doesn't take into account that perhaps that unit that got paged out for that was busy on another call. So that's another set of data that I know you will have had and
Right.
will continue to bring to us.
Yep. So we have our benchmarks, which are those goals that Sarah had mentioned, the 4 minutes and the 10 minutes. I think it's 8 minutes, even though I know that we have 10 minutes up there. And then our baseline, which is our actuals. So we compare our actuals to our targets and we separate them out into those different components. And then, yeah, we have our total incident count. This is actually the first time that we've announced in 2024, we had 17,572 calls for service. Of those calls, we could have 1 medic unit or 1 fire truck respond. We could have, I like to joke, like half the city respond. So that is just how many times LDCFM was dispatched. So the discussion topics for today, this is now where we're transitioning into what was actually presented last night at the City Commission. We're going to be talking about service scope, operational model, and then terms of agreement and financial considerations that we're looking for input and direction from you all. So to start, we're going to talk about service scope. Should LDCFM continue to operate under the current model, which we discussed earlier, with Douglas County and the City of Lawrence combining to provide EMS services countywide? Should the City of Lawrence and Douglas County continue to partner to provide LDCFM as we know it today? And then we have this little emblem, this logo that was used in our strategic plan that just shows that our parent through the agreement is the City of Lawrence, but we operate with parents as Douglas County and the City of Lawrence to create LDCFM.
Oh, I had a question I forgot to ask before. Do you have mutual aid agreements with Eudora and Baldwin and the independent fire districts?
So if our previous chief, Chief Llewellyn, was here, he would laugh a little bit before he said this, but we had a lot of handshake agreements. And so during his time here, he really started to get those documented and through the correct legal process. And so we do have some in the works. Our intention is, our goal is to have agreements not only within Douglas County, but surrounding agencies thinking about large scale incidents and being prepared on more of like the emergency management side. So some, not where we need to be. I know that we conversed today about Consolidated's mutual aid agreement, but really the working relationship between all of the departments and with Douglas County Emergency Communications Center is that's how we operate as mutual aid. However, getting those formal documents is very important.
And would that include DeSoto?
I know that there were go ahead. There were conversations a few months ago before Chief Llewellyn left LDCFM, and it's my understanding that there's still intentions as far as like other groups in Douglas or in Johnson County, and then also like literally all around LDCFM, including DeSoto.
Yeah, I was just thinking if the Panasonic plant had a big fire, they would want your help, I'm sure.
Yes, and we're even talking about the World Cup is coming to Kansas City. So thinking about it at a little bit more of a regional concept, but being able to capitalize on some of the challenges or some of the obstacles that we'll be going through potentially for World Cup, and being able to implement those and continue some of those partnerships beyond that.
Mr. Dorsey, that we have trained with DeSoto. Chief Baxter's over there now as their fire deputy chief, and they've come to Lawrence and they've trained with us just right across the street. As a matter of fact, just recently, and doing some roof operations. And so we do have buy-in because the Panasonic plant is there, and if something happens there, then we will all be involved in this area. So we're looking at training opportunities as well. We're just working with our peers, and so yeah, we see that coming down the road.
So then, I appreciate that question. Those emergency management agreements, then whether they would be with either Panasonic or like for the World Cup, are those financial? Would those be revenue generating to some degree for LDCFM?
I mean, most mutual aid agreements are just, we agree to
Just
help each
mutual.
other out.
Okay. all right.
And release each other from liability and do
Okay.
those types of things. I don't know really of any mutual aid agreements where you're paying somebody. Now, if you were in some sort of FEMA situation and you can get reimbursed from the feds, maybe you'd get money back. And that is different than the relationship with the University of Kansas. But normally fire department to fire department or government entity to government entity, they're not exchanging dollars back and forth.
Okay.
In larger metro areas, they might, if there's true overlap or like a lack of serviceability and someone has to continue doing it. But here, we
But
do
not
not.
here.
Forgive my ignorance, but does KU have their own fire department or do you manage their
Yep.
fires?
We respond to all parts of the University of Kansas as well.
And tell me how much of that cost is covered by the University of Kansas?
0.
0.
The staged question. Thank
It
you.
was. So operational model, should LDCFM continue to provide the same service programs? And then also, what are the acceptable service levels? We talked about the service programs earlier with fire, EMS, tech rescue, and hazmat. The next slide, I believe, is our EMS service or program service level matrix. So for the city of Lawrence, they're using a program called the Balancing Act, and that's where we look at basically all of our services as a department that we provide. We break that out, we expense all of our expenses or allocate all of our expenses to the programs in different ways. And then we look at different service levels we identify where we are right now with different components, and then say, if we increase budget, this is what it looks like. If we decrease budget, this is what we can anticipate things looking like. So this year we have 8 programs, whereas last year we only had 3. We had support services, community risk reduction, and operations. And so now we have things like administration, like basically administrative stuff. We have logistics, we have public education and community interaction, we have fire prevention, we have EMS and fire. So 2 of the things that we've brought up on the program today, this is our EMS, and I cannot read all of that from here. However, we do talk about staffing and the level of service for EMS. We talked about ALS and BLS earlier, advanced life support and basic life support. Do we want to be a service where we all just are basic life support EMTs, or do we want paramedics? Like Chief Hardy mentioned earlier, all of our new recruits are going through paramedic school within the first 3 years. And so that was a service level decision that was made. We also look at our accreditation compliance for EMS specifically. So within our accreditation process, we write to how our EMS program works, and we look at our response time and our critical tasking and all the things EMS to say, are we doing what we're saying we're doing? And then cardiac arrest survivability. This is a key performance indicator in the city's strategic plan that LDCFM has also is important to us. We present about it at all the other presentations that we've done, annual updates, is cardiac arrest survivability. And so this is one of those things that aligns with the city strategic plan. It's a key performance indicator that we keep up on. And then we have added it into this as well. And then we also have the, yep.
Can I ask about that one?
Mhm.
So the survivability rate for cardiac arrest, is that when you're talking about that's a benchmark through the City of Lawrence strategic plan, is that something that would be through all of LDCFM that would include the rural areas that would fall into that area? Or are we having two different benchmarks and yet the county pays for one level of service for the city and within the City of Lawrence and another one outside of the city?
Yep. So the way that we find the cardiac arrest survivability data is countywide. So our EMS services, we talk about it countywide. However, if we're looking at specific, like if there's an area that we want to look at, we can dial into like that district or that zone. For this, it is countywide. LDCFM inputs data into a system as LDCFM, as Douglas County. And then this number comes from that report. And then that's how it's called CARES.
Cardiac arrest registry or something. I can't remember the exact, but yeah, it's in, so it has certain criteria for defining cardiac arrest survivability, and they have to meet certain inclusion criteria, like someone who's been deceased for a day. There's not any chance of survival, so we're not going to count that. So there's some nuance to it, but without getting into the weeds, that's what you had.
It's also a consistent thing to compare communities and the survivability rates. So that is one reason why it was selected, because it is something, I believe it was also used on the ICMA key performance indicators that we had adopted.
Kenzie, you mentioned that that was a service level condition decision that was made, right, to have them move to paramedic level.
Mhm.
Who was that made by?
So part of that, so that was made by LDCFM in the sense of staffing, having adequate staffing for our ambulance units. So there has been studies, Kevin Joles was a part of it when he was here, and they were trying to identify how do we not have burnout from our paramedics that are constantly on ambulances running these calls? What's the proper staffing level? And so the decision was made, anyone that's new incoming, they're going to become paramedics until we get to a level that is adequate, is one way to put it, so that we can start decreasing that burnout and that wear and tear on individuals. So that is something that is always up for discussion. And I would even throw out a conversation for each budget period, because there is a cost that comes with that. As far as personnel services goes, there are paramedics, so you're paying them at a higher level. But then also with paying for paramedic school and the things that go along with that.
Yeah, thank you.
Mm-hmm.
So when a guy reports for work on Monday, could he one week be on an ambulance and the next week be on a fire truck? So everybody's cross-trained and you reduce the burnout by rotating between services, if you will.
Yep. And so the manager at each station has the ability to shift individuals around from their assignments on each truck every day. So they are living in the same station. If the medic unit goes out for 12 or 13 calls and we have someone that's exhausted, it's that manager's responsibility and role to identify that and say, the fire truck is a little slower. Let's go ahead and rotate. So that can be done. I think typically they do each tour. So when we were talking about like a Monday, Wednesday, Friday, and then off for 4 days, I think they typically do, you're assigned to the medic unit these 3 days. If you get beat up, we'll switch you out. Same thing with different stations. We have some stations that are busier than others. If someone is needing that rest, then they communicate through the chain of command and we can alter through the system.
And I can speak to that. In 2003, I became a paramedic and we only had 2 people within the station that could be on the medic truck. On some stations, you may have only been the only one. And so the burnout rate was going a lot faster there. And so speaking of the paramedic level and the AEMT level, we used to have at EMT ID level and just basic EMT. So we're hiring EMTs now, but with the expectation of them to go to paramedic school. And so those are the levels that we've got. The skill level, EMT basic can do basic, life-saving measures, and the each level you go up, they can do more things. And so the paramedic is our top level of what we, is what we put on every of our ALS trucks, right? So they can do the top level skills on a call. And so we've chose to put paramedics. When we first merged in 1997, we had 2 firefighters, EMTIs with paramedic. And that was, I think, just to kind of make sure it worked. Then we transitioned with 1 EMTI with a paramedic. And so that's kind of what the rotation's been like. But now we've got paramedic level and everything, apparatus. So now we have even ALS fire trucks that when a medic truck is out, a fire truck can respond and still give the same amount of care that an ambulance could do, just not transport.
So I'm curious, I didn't think I saw the slide in this, but it was in what was in our packet that shows EMS, levels of program. And I think it was a 3, it was a 4, and then the fire one was a 3. And I'm interested if there's been any analysis done as we keep hearing the cost of EMS keeps going up. Have we done any analysis of whether the cost has been going up because the level of service, the types of programming, the staffing that we're doing is also increased, or is it just based on call volume? I'm trying to understand whether we're getting into a cycle of we need to provide really great service so this cost goes up. And are we looking at the overall cost as being a result of those decisions or a result of just the total need? Does that, I haven't quite fleshed out my question there, so I'm a little fumbly.
So I think I understand.
Yeah.
And I think you're headed in the right direction in the sense of we become creatures of habit. You start going for excellence. What is needed to get there oftentimes is super expensive. One thing that we're really excited with these programs and with the balancing act tool is being able to identify what do we want to be really good at and what do we want to focus our efforts on versus what things can we cut back on because we can't just keep raising the level of everything. We can't, we don't know maybe if we want to be the best in something or just be adequate or just provide quality care in a specific realm. One thing to, kind of think about is what are we doing technical rescue wise or fire investigation wise, where there might be other services out there that LDCFM doesn't have to provide that specific thing? And would there be a value in looking into those alternatives? So I think that I'm hopeful that the balancing act will help us not only articulate what we're doing and what we're currently striving for as far as service levels. We identified as a 4 for EMS and a 3 for fire suppression. And then you'll see all of our other programs and the scoring. But then say, maybe we don't need to be a 3 or a 4 in this. What does a 2 look like or a 3 look like? Or 4 is not good enough or 3 is not good enough. Let's go up 1 and see what that looks like. But then actually following through and making those changes instead of, excuse me, getting a budget reduction and saying, well, make it work. What does that actually look like?
Patrick kind of jogged my memory, but if you're sending everybody to paramedic school, then your cost of doing that's going to increase for a few years while everybody's going to school. But presuming your staff doesn't turn over, that cost should go down at some point, right?
Well, and to be clear, that's not our entire staff, that's new hires. So we have a significant number of our personnel that have not expressed any desire to go to paramedic school and are not required to. And so those people will continue to function at the AEMT or advanced EMT level, where they can still provide some ALS services, but not the full package that's provided by paramedics. As we look into it, also, I think, and I don't have the hard numbers in front of me, but while there is a cost associated with sending people to paramedic school, it's not a main driver of increased cost and revenues. And there may also be some benefits. I mean, not just in terms of overall excellence, but there is costs associated with turnover from burnout. There's costs that are associated with needing to go out and rehire. And so when we take people and we're not hiring people who have a certification, we're, building them into our system from day one, we tend to have better outcomes in terms of the patient quality of patient care provided. So that's There definitely is a cost to anything we do, but I don't think that is a main driver of any of the changes is that, but it has helped with a lot of retention, I think.
I had a question on a different issue. Do you have a peer support program to help with PTSD and debrief over certain incidents?
I would say we have a really good one. In fact, we actually had training on it just today for our entire the shift that was on today, and we have a peer support team that is a kind of a labor management collaboration, and actually is led by a retired firefighter now, who's still kind of active in that. We have a chaplain. I mean, I'm very grateful for the strides that have been made in terms of responder mental health since even I came on.
We also do have a budget that we allocate every year for our first responders to speak with someone, speak with a counselor or specialist, a therapist. So we do have that we allocate a lot of money towards, and it gets used. So we're happy to see that. But then within our report system, if crews go on a call that for some reason hit someone the wrong way for whatever personal reason, there's a button that they can click, and then we can do a debrief on that. Or a shift commander can reach out to that crew or a member of that crew to have more of a one-on-one and connect them with resources. So that is one thing that we have seen the fire medical service upgrade and excel at. I mean, compared to 10 years ago, as trying to normalize that in the culture of if you're not okay, we're not okay. Let's make everything better.
You have a question, Pedro? Okay, so can I interrupt here? Because I think on this one, on how the methodology came together, I really think there's a lot of simplicity and beauty in what we did the last time through. Under the old agreement that was there for 20 years, there were two options, fire or medical. And so we spent a lot of time arguing over what was in what bucket. And what you've really seen now is you have a system that's not designed that way. You have a system that is both. And so I really feel like when we sort of accepted that the methodology is that there's some pure fire and there's some pure EMS, but the vast majority of LDCFM's expenses, like 90% of their expenses, is in the shared services. And that model of really, it isn't just it was a car accident with a fire, but also with an ambulance transport. It is part of that shared service. And your firefighters, your staff, the vast majority of expense associated with the budget is in that shared service bucket. And so then that shared service bucket is divided by that standard of cover ratio. And so the city of Lawrence budget is paying for those shared services as well as the county. We do not pay for things that are fire only here at Douglas County, and they don't pay for things that are EMS only. But those amounts that are in items 1 and 2 are pretty small in the vast majority of how LDCFM is financed.
I know we're getting short on time and you have some policy questions at the end. You want to make sure we can hear back from that.
Perfect. So these are all of the questions that you guys just saw. I know that we have one cutoff at the end, I believe. And that is just, are there any concerns or questions with this methodology? So yeah, now I'd like to just open it up for your thoughts.
Well, I'll start. First, I think the model that we have working in partnership, it works really well. We spent a lot of time a number of years ago looking at that and examining it, and is it the best for our community? And I think the third party that looked at that down at Wichita State, the report, I was flipping through it again today. It was like, yes, that's the smart way to do it. And so I think we should continue that. That being said, I want to make sure that we're not limiting ourselves when we think about what that partnership looks like. Does it need to involve our rural fire districts more? Does it need to involve Eudora and Baldwin? Maybe we're so focused on Douglas County and the city of Lawrence that we're not thinking how we could. That was part of my question about when we think about response times, is are we including those first responders when they get there, that maybe we're not thinking broad enough. So my response to your first question is yes, and let's not hold ourselves just to that.
So I agree in terms of the partnership. I think it's wise, and I think we gain a lot out of it. Having folks that are cross-trained for both fire and EMS, I think has been really strong for our community. And that's one of the reasons I was asking about like the first on scene for medical, looking at those times across the boards that we're comparing apples to apples when we look at our rural areas, because it looks as though we've got these massive deficits in, well, my district, and that's not the full story, right? So and in order for us to make this next policy agreement, we need to know how the rural is specifically, we need to know how the rural area is being served equitably with our larger cities. So and echo Commissioner Kelly's concerns, like that's something that we will need to talk about certainly much more in depth than what we'll get to today. So that's one piece. I think looking at some of those broader collaborations are good. I know one of the pieces was that LDCFN was providing the ongoing medical training for first responders in the rural area, and that had some hiccups just in terms of personnel and time. But that's another piece that how are we working together and supporting the county-wide services. I do think that as we dig deeper into call types and call volumes, that percentage of in the shared bucket will probably slide. And I think that's a conversation that I think we'll be open to having what that might look like. The biggest issue that I've seen with the way we've worked together with the city is in budget time, and just how confusing that's been for the department of having to go to this, the county goes first in the budget cycle, the city goes second. But the way it's written, the city really calls all of the shots. And then we're having to like backtrack and redo based on the decisions they make in their budget cycle. So how much say the county has, like if we end up paying more, we need to have more say, and how we streamline that, because I think that was incredibly stressful on all involved, but especially on the leadership at LDCFM.
I agree with both commissioners and the fact that the current model, it does appear to be working really well. And one of the reasons why I asked the question about or requested some education around the unincorporated areas is because I also think that we need their voices at the table. We need to have some conversations with them about what their needs are, what their gaps are, and if it would be appropriate to build them into this particular model for the next 3-year contract or agreement. And so, but yeah, currently, this particular model, I do think that it does appear to be working well. We just need to have some more conversations.
And we've had turn myself off. There's a lot of change going on countywide in terms of fire EMS service. Eudora's done an assessment. They're looking for a new chief. We have an interim chief with CFD1. I think some of those conversations are probably longer than just a 3-year model. If we're going to think more countywide in terms of some of this and different models of service, it's a much larger conversation.
I would suggest that we go with a longer than a 3-year contract and structure it so it could be modified a little bit without going through the whole thing again. So I would personally prefer at least 5-year contract.
This is Commissioner Reed, and I would agree. I think 5 years seems prudent at this point, having been through sort of the beginning, middle, and now this stage of that very quick, sort of radically different and new agreement, and now quick turnaround. I think in some ways that 3 years initially was perhaps not a bad thing, because it really, the information is that we have and that we've been considering in recent years about this new agreement, and as a sort of byproduct of it, I think there's value to having this conversation about this time now. But I agree that some planning for a 5-year cycle makes a little bit more sense, and would echo fellow commissioners' comments that thinking more globally, so to speak, about what the real tangible day in, day out relationships and and mutual aid and work sharing, what that looks like already between LDCFM and the township fire districts, and City of Eudora and City of Baldwin. I think that those conversations that sound like they're sort of naturally occurring, and so many relationships that are long lasting, and the handshake agreements that are sort of in progress into more formal MOUs. I think all of that, I hope, is sort of a part of the more global conversation as the city and the county think through what the next iteration of this agreement is. And then the other thing I'll just sort of highlight in response to all these questions, should you all continue to provide the same service programs? To your point earlier, Mackenzie, perhaps it's true that there are the list is a little long, and that we've picked up some initiatives or programs or services that made sense at one point in time that maybe don't anymore. I'm interested in unpacking that a little bit more in time to really understand, beyond the sort of obvious things that we know LDCFM exists to do, what else is it that you all are doing that's costing money and resources and having an impact on your staff and their ability to serve. So I'm definitely interested in unpacking that more and really hearing from your department and your personnel what feels really critical to keep and what I think it's healthy to think through what feels okay to let go of, and have some recommendations about that in the future is what I'd hope for. And along with that, acceptable service levels. We had a little bit of discussion here. It's always a part of the discussion, how we define that. What standard of cover? I think there's different phrases and even different definitions depending on maybe the source of who you ask or what sort of metrics we're looking at for service levels. I appreciated the charts that you provided in these slides, and I think that's a good visualization that we haven't really seen in recent years, and so I appreciated that side-by-side comparison. And so I think there's more to be discussed about that. I will say here and now that I have concern about rolling back service levels. And I think that there's a degree of excellence that this community has come to expect because the degree of excellence that LDCFM has really put forward in the history that we've sort of had reviewed tonight, and that commitment to a high level of service. And I hear about that in the community, and it's something that is valued highly in this community, and it's something that obviously costs money, and it's a conversation that I think is important for us as elected leaders and city commissioners to be constantly talking about the relationship between and the correlation of that, and that those expectations of high services do come with a price tag. And I am of the personal opinion that those are high value dollars being spent by our community, and that they're really critical investments. So I'm keen to work towards how we maintain that rather than roll it back. But in the same vein, I recognize there are tangible realities of what your personnel does day in and day out that can inform us much better than community feedback even about what is critical and what might be handled differently in a different way that's more efficient. So I hope that feedback is helpful in response.
Commissioner Kelly, I just want to piggyback on something Commissioner Reed said, and it's something I'm hoping that the group that's working on this next agreement can really focus on, and it's really around governance and when we make decisions and how we make decisions. As a commissioner, oftentimes we'll hear like, this is going to be the price of fire service. And then to Commissioner Willie's point, they come back around and it's a different cost in the end. And that's a really tricky thing. And I recognize it's part of a partnership, but I think there are ways that we can look at that agreement in a way that when we do look at service, what types of services we provided, what level of service we provide, that maybe our county commission, our county staff, not that we don't have a say right now, but typically we don't make that decision. It doesn't come to us. It's not something we discuss at all. It's determined by the city and then we need to pay for that. Just the fact that we can't articulate today, like what is the actual cost of some of the decisions that we've made, tells me that I would like to have a little more attention to that paid by the county, since that's the big part of our cost. And if we're setting that cost, a differential of that cost of shared, because we say it's shared cost, but we pay a percentage of that shared cost, then we need to really understand what that is. And that goes all the way back to planning for capital expenses. I know we have a capital plan and we don't want to hold future commissions to it, but we also need to have some honest conversations about what we're going to actually financially be able to do, so that both of our bodies, and maybe other groups as well, as we've talked about here, can understand what we're promising to our community, and do we have the fiscal resources to do that. So that's a lot, but I really just think there's another way to look at governance. Right now we sort of say, hey, you pay the majority, you get to govern it. Maybe I'll be sorry for saying this down the line, but I think there is some shared governance that can happen on this that's not happening now.
And I think we've made some, I would say there is substantial progress that's been made on that over the last 3 to 4 years in terms of my engagement with LDCFM and from an administration standpoint in this decision-making, that may be just a little under the radar for elected officials to see on our side. And I think we can do more in that space to elevate those issues to you as a body and talk about what they mean. I think we were starting to do that around the expansion, but on some of this base conversations, I would say that it's hard because some of these conversations are very technical, and so trying to make them lively, or how do we tell the story behind how some of this happens, I think is something we can definitely do better at.
So we've come up close to our time, but I don't want to cut this short. I think these are important conversations. So I just want to first give a pass to commissioners. Do you have other questions or thoughts you want to share? Not seeing, I'll turn back to Mackenzie and say, are you getting what you need out of this conversation so far?
I believe so. Yes. I think that we have information from now the City Commission and the County Commission. We have multiple sets of notes of what you all have either expressed or questioned, and our governance committee will meet, come up with some next steps, and then present back to the city and the county commissions as well.
Commissioner, I did think of one more question I had incoming, but I didn't write it down. It just came back to me. And now I'll just turn it into a comment, really, which is we didn't talk about the breakdown of the 10% administrative fee as part of the methodology. And we don't need to go down that rabbit hole today, although, probably an important point for new commissioners I won't try to explain it well, but I'm interested in some feedback on that, and has it overcomplicated things over the course of the past few years trying to figure out that math? Does it make sense the way we thought of it? So just want to flag that piece of the calculations, and interested on some feedback later in the year about that administrative fee.
I can make a quick comment just to all things budget wise. It is very difficult. As Commissioner Willie had mentioned, it is very difficult to go between the city and the county with different charts of accounts. The Douglas County team and the city team are great with helping us identify what things are crossed and what goes where. We've talked about in our governance committee that those budget conversations are extremely difficult to figure out what's increasing and what's decreasing with those different charts of accounts. We have a spreadsheet that's set that also includes the admin fee calculation and what it doesn't include, dispatch, internal service fees at the city, things like that, and then takes the percentage. So right now that is streamlined in a standard document that we've used for the last 2 years or 3 years that we plan to use going forward. There's a few little enhancements that we make every year, but we bring that to the governance committee, and then it's consistently exchanged between LDCFM, the city of Lawrence, and then also with Douglas County.
Yeah, I appreciate that. I'm remembering a quote from Commissioner Portillo that I'm going to get wrong, but collaboration is hard. And LDCFM folks really live in this space. It is extremely hard to provide a service this way with 2 bosses and 2 governing bodies making decisions about a shared service. So I really appreciate the work of this team and how they have just embraced that we're all here, we're all on the same team, and I do think we're getting there. But it is real. It's the chief doesn't have 2 credit cards anymore, but he definitely has 2 set of books for certain parts of the budget, and that is a complexity that most city departments and county departments don't have.
We're so grateful for you being here and having this conversation and really coming back and questioning some of our assumptions so that we start on the right path. So thank you for that. And thanks for all of listening to this feedback. And I'm sure we will be in touch more in the future. But with that, I think we are recessed until our 5:30 business meeting. Thank you very much.
Thank you.